Mrs. Shah is a 65-year-old female. She was on a 20-hour flight alone from India. She speaks very limited English, so she has a medical interpreter here with her. She's staying alone at a hotel, and her family's going to be here in a week to be with her and help care for her. But in the meantime, there's a social worker. He's going to be in later today to speak with her about the home health care that's provided by the hospital because she has no insurance or transportation. The ambulance brought her straight from the airport to the hospital because she was having pain in her right leg. When she arrived at the hospital, she had +2 pitting edema, pain in her right leg. It was a 10 out of 10. The doctor came in early this morning to confirm a sonogram revealed a DVT in her right leg, and then he placed her on Dilaudid for pain.
What is her pain level?
Her pain level was a 10 out of 10, and now it's a 2 out of 10.
Okay.
He also placed her on heparin and Coumadin for DVT treatment. Mrs. Shaw, this is Joy. My shift is over. She's going to be the nurse for the rest of the day. Do you have any questions before I go?
Doctor told me DVT that I have in somewhere, but what does that mean?
DVT means deep vein thrombosis. It's basically a blood clot in your leg that is formed. Because you were on that long flight alone, your blood wasn't circulating as well, and it formed in your leg. That's why you feel the pain. It's blocking all the blood flow from your leg. That's why you have the swelling and the pain. So you're on another drug called heparin. Basically, while you're in the hospital, that drug is going to keep your body from forming any more clots or that one getting any bigger. You're also going to be taking Coumadin in the meantime. It takes 3 days to work, so while that's kicking in, you're on the heparin. You're going to be sent to your hotel on Coumadin, and you're going to have a home health nurse come and help you take your medications while you're there, since you need that drug daily. Any other questions?
No.
Okay.
Good morning, Ms. Shaw. I see that you've called. What can I help you with today?
I'm having a lot of pain on my leg. Can you do something for it?
Okay, can you tell me what your pain level is from 0 to 10?
I guess it would be 9.
9, okay. It looks like it's about time for your second dose of Dilaudid. Let me go ahead and just take your blood pressure, your respiration, and your pulse before I administer it, okay? Okay. So basically, Dilaudid helps with your pain. It's an opioid, so it's going to block the pain signals that's coming from your leg to your brain, and that's what's going to help lower your pain. So your blood pressure is 120/82. Your pulse is 86, and then your respiration is 14. So I can go ahead and administer your next dose of Dilaudid. Okay. And then, is there anything else I can do for you? Okay, I'll be back in 10 minutes to check on you, okay? Good morning, Ms. Shaw. I'm back to see if the medication helped your pain. Can you tell me your pain level from 0 to 10?
It's about 3. It's been a lot better.
Okay, good. So I'm going to go ahead and tell you that basically every 4 hours you're going to start to feel the pain again because Dilaudid becomes distributed to your body, and then it gets broken down in the liver, and then it gets excreted in the urine. So every 4 hours or so, you're going to start feeling the pain, and that's when we're going to give you another dose of your Dilaudid, okay? Okay, so some of the side effects of Dilaudid are constipation, hypotension, and dizziness and drowsiness. If you need to use the restroom, go ahead and ring your bell, and I will come and help you. Also, you will feel slightly dizzy, so make sure that you don't get up on your own. I will help you sit on the side of the bed to help you gain your composure, and then I will help you go to the restroom and then come back to your bed because since it's an opioid, you are more likely to fall. Okay? Okay, so Just let me know if you need anything else, and then I'll come back and check on you, okay? Okay. I'm going to tuck you in. While you were in the bathroom, I checked your urine. There were no signs of bleeding. I also checked your IV site, and it's fine as well. And before you went to the bathroom, I also monitored your PTT, your labs, your PTT, platelets, and H&H, and they're in a good range. That indicates that your medication is working properly. Okay? Okay, so I'm going to go ahead and tell you that if you see any, in case you vomit, make sure that you look for any signs of bleeding. If you see any coffee ground material, or if in your urine there's blood or any type of discoloration, and if you have a black stool, make sure you go ahead and contact your physician immediately. Okay? Okay. And as I've mentioned, heparin does increase your risk for bleeding. So I'm gonna go ahead and give you a soft foam to use to brush your teeth, because if you use a toothbrush, it will more than likely increase your risk of bleeding. Also, try to avoid taking aspirin, because that will also increase your risk of bleeding as well. Okay. So if you need anything else, go ahead and ring your bell, and I will come back and help you. Okay. Ms. Shaw, what can I help you with?
I was wondering why I'm on the same medication for both.
Okay. Well, your blood contains substances that help your blood clot. You're currently taking 2 meds that will either stop or slow down the clotting process. Because Coumadin takes 3 days to work, you are currently in heparin, which works faster. Heparin interferes with the clotting substances. And just like Dilaudid, heparin becomes distributed in your body. It becomes broken down in your liver, and then it leaves your body through the urine. Okay? Well, Coumadin reduces the amount of vitamin K in the body. Coumadin decreases the amount of vitamin K in your body. It will also slow down the clotting process. This way, we are also preventing future blood clots from happening. Leafy greens can interact with the Coumadin, so make sure that you don't suddenly increase or decrease the leafy greens that you consume, such as salads and such. Regular blood work is also required to make sure that the Coumadin is performing optimally in your body still. Okay? Okay?
It's a lot of information. I would like it to be printed. Is there something that I can take it with me?
Okay. Let me go ahead and okay. Hi, Ms. Shaw. I'm back with your pamphlets. They're actually in Hindi. I made sure they're in Hindi. They include information regarding Indian dishes that you need to avoid. It also talks about the side effects, because just like heparin, your risk for bleeding is increased while you're taking Coumadin. These pamphlets also include instructions on how to avoid the risk of bleeding, such as using soft toothbrushes, not using razors, and such. It also tells you to report signs of red and orange colored urine, black stool, or vomit that looks like coffee ground. And pretty much it just tells you, the rest are just information on how to just decrease your risk of bleeding. Is there anything else that I can do for you?
I heard about temple being around in Orlando. Can you get me some information? I would love to pray.
Okay, of course. Give me 5 minutes. I'm gonna go ahead and look for it for you, and I'll come back and give it to you. Okay? Okay. Here are your I'll be back with your information, okay?
Thank you.
Ms. Shaw, I'm back to give you the pamphlet, information about your Hindu temple. I actually found a Hindu temple location brochure. It has the phone numbers listed. If you would like, you can call them and see if they can provide transportation for you to go to the temple. Or you can also ask your social worker if there's any available transportation as well. Your social worker will be coming in a couple of hours to provide you more information about your home care nurse that will be provided by the hospital. Your physician also found a Hindi-speaking doctor who you will be able to have a follow-up appointment with in 1 week. He will be checking your cumulative labs and then educate you more about your meds. Okay? Is there anything else that I can do for you related to your cultural background that will help your stay here more comfortable?
No, there is many.
Okay. If you need anything else, just give me a call and then I'll be right over. In the meantime, you have a good day, okay?
Good morning. My name is Derek Cameron. I'm a social worker here at Florida Hospital. I understand that you had an unfortunate circumstance coming from India to the United States of America. I just want to make it known to you available resources that are at your disposal. Florida Hospital will be providing you a home health nurse. She will come and assist you with various ADLs or whatever you may need. They'll also be assisting you with transportation. Transportation will also be available to you. And I understand that you don't have health insurance, but we'll be providing all this for you, okay? Any questions? Okay, I just want to wish you a speedy recovery. I hope everything works out for you, okay? All right, take care.